We have multiple injuries now, abdominal expiration, orthopedic fractures.
Only 9 out of 36 health facilities are partly functional in the whole of Gaza. All of these in the south. There are actually no functional hospitals left in the north. Al-Ahli was the last one, but is now minimum functional. Still treating patients, but not admitting new ones, along with Al-Shifa, Al-Ada, and Al-Sahaba Hospital.
Goods, trauma supplies, essential medicines, and we try to take out at least 24 patients and possibly more.
Until 2 days ago, it was the only hospital where injured people could get surgery in northern Gaza, and that was overwhelmed with patients needing emergency care. There are no operating theaters anymore due to the lack of fuel, power, medical supplies, and health workers, including surgeons and other specialists.
Only 5. So most people are getting here.
So these hospitals are still sheltering also thousands of displaced people. At Al-Ahli, currently about 10 staff, all junior doctors and nurses, continue to provide basic first aid, pain management, as much as possible, wound care, and trauma stabilization services. Many of these patients have lost family members and don't have anyone to bring them water or food. Some of them are severely injured and have been waiting for surgery for 2 weeks. Others have been operated on but are now at risk of post-operation infection due to lack of antibiotics and other drugs. All these patients cannot move and need to be transferred urgently to have a chance to survive. Bodies from recent attacks are lined up in the courtyard and they can't be given safe and dignified burials.
These are the ones that leave the cars here
because they were not allowed to cross.
Yeah.
I'm not surprised neither, but if we see again.
The WHO calls again for a humanitarian ceasefire. This is needed now to reinforce and restock remaining health facilities, deliver medical services needed by thousands of injured people and those needing other essential care, and above all, to stop the bloodshed and death.
You said there was an attack on the courtyard here.
Yes, this is the very location of the rocket.
When did that happen?
This on the 17th of October.
17th of October.
Yeah.
What we found here is a hospital that's really almost completely stopped functioning. 2 days ago, a number of staff were detained. Just last Saturday, we visited Al-Shifa and they were telling us how they were sending surgical cases here because Al-Ahli had some of the only operating theaters left in northern Gaza, in Gaza City, and those are now no longer functional. They don't have specialists, they don't have surgeons, they don't have power, they don't have water, they don't have food. We've brought some medicines and medical supplies today, and we're going to go see the 80 patients who are still here, who are sheltering in the church on this site and in the orthopedic building. But they're not able to perform surgery. They're able to only provide pain management, some wound care, some trauma stabilization. They're doing their best with a very small team of only about 10 clinical staff left at this hospital. And so what services are you providing now?
So we are making first aid, dressing, antibiotic coverage, whatever we can. Of course, you can see the body bags here.
In the building nearby.
The square, and some of them were wounded, and died.
This is where they've brought patients to.
So this is no, this is part of the inpatient departments here. So it's a very small hospital, so we don't have much spaces to put the wounded.
I'm currently in a church that is on the grounds of Al-Ahli hospital in Gaza City. This church has been turned into an inpatient ward with very serious cases, children, women, elderly people, post-operative cases, people with external fixators, people on IV fluids, small babies. The few hospital staff who are left here, about 10 hospital staff, are caring for patients in this church building, with patients literally sleeping on the church pews. Yes. I'm coming.
Come through here,